Medicare costs are going up again in 2026. For millions of seniors, retirees, and people with disabilities, this increase may directly affect the amount of money left in their monthly budget after healthcare expenses. The standard Medicare Part B premium is rising to $200.90 per month, and the annual deductible is also increasing. So the important question is simple. How much more will seniors pay, and what does this mean for Social Security income? Hello and welcome back. Today we are covering an important Medicare update for seniors, retirees, caregivers, and families planning healthcare costs in 2026. The Centers for Medicare and Medicaid Services has confirmed that the standard monthly premium for Medicare Part B will increase from $185.00 in 2025 to $200.90 in 2026. That is an increase of $17.90 per month. CMS also confirmed that the annual Part B deductible will rise from $257 in 2025 to $283 in 2026. This story matters because Medicare Part B covers important outpatient medical services. These can include doctor visits, preventive services, outpatient care, medical equipment, and many other services that seniors may rely on throughout the year. For many retirees, Medicare premiums are not just a healthcare issue, they are also a retirement income issue. That is because Medicare Part B premiums often reduce the amount of Social Security money seniors actually receive each month. According to CMS, the standard Medicare Part B premium in 2026 is $202.90 per month. That means beneficiaries paying the standard amount will pay $17.90 more per month compared with 2025. Over a full year, that increase adds up to $214.80 more in Part B premiums. CMS also says the annual Part B deductible is increasing to $283 in 2026, compared with $257 in 2025. That is a $26 increase in the deductible before Medicare Part B starts covering certain approved services. For seniors on fixed income, even a monthly increase can matter. A premium increase may look small on paper, but when it is combined with higher food prices, housing costs, utility bills, prescription costs, and other medical expenses, it can create real pressure on household budgets. Medicare Part B premiums are adjusted each year based on expected healthcare spending and program costs. Part B helps cover many medically necessary services, including physician services, outpatient care, certain home health services, durable medical equipment, and some preventive care. The premium increase also comes at the same time Social Security benefits are receiving a 2.8% cost of living adjustment for 2026. The Social Security Administration estimates that the average retired worker benefit increased from $2,015 before the COLA to $2,071 after the COLA. But here's the key issue. A higher Social Security check does not always mean a retiree has much more money available to spend. When Medicare premiums rise, part of the Social Security increase can be absorbed by healthcare costs. This matters for three major reasons. First, Medicare is essential for seniors and people with disabilities. Most retirees cannot simply avoid healthcare costs. Second, many seniors depend heavily on Social Security for monthly income. Even small premium increases can affect their ability to pay for groceries, transportation, utilities, rent, or prescription drugs. Third, this increase reminds retirees that healthcare planning is a major part of retirement planning. Medicare is not free, and out-of-pocket costs can change every year. For someone living on a fixed income, the real question is not only, did my Social Security increase? The bigger question is, how much money do I actually have left after Medicare and other costs are deducted? For ordinary seniors, this update may affect monthly budgeting. A retiree who receives Social Security and pays the standard Part B premium may see a higher Medicare deduction in 2026. For some people, the Social Security COLA may still provide a net increase, but for others, especially those with high medical costs, expensive prescriptions, rent increases, or limited savings, the extra Medicare cost may feel like another financial burden. Caregivers should also pay attention. if they help parents or elderly relatives manage bills, this is the kind of change that should be included in the family budget. Seniors should review their Medicare costs, check their Social Security benefit notices, and compare their total healthcare expenses, not just the monthly premium. From a policy perspective, this is not just a Medicare pricing update. It is part of a larger retirement affordability problem. Healthcare costs remain one of the biggest financial concerns for older Americans. Even when Social Security benefits rise, medical expenses can reduce the practical value of that increase. The 2026 Part B premium increase also shows why seniors should not look at Medicare, Social Security, prescription drug costs, and retirement income separately. They are connected. A higher Medicare premium can reduce monthly cash flow. A higher deductible can increase upfront medical spending. And a modest Social Security COLA may not fully protect seniors if other essential costs continue rising. This does not mean seniors should panic, but it does mean retirees should plan carefully, review their Medicare coverage, understand their expected out of pocket costs, and seek trusted guidance if they are unsure about their options. The bottom line is this: Medicare Part B costs are rising in 2026. The standard monthly premium is increasing to $202.90, and the annual deductible is increasing to $283. For millions of seniors, this could reduce the real benefit of the Social Security COLA and add more pressure to monthly retirement budgets. This is why every retiree should review their Medicare costs, Social Security income, and healthcare budget before making financial decisions for the year. What do you think about this Medicare premium increase? Do you believe the Social Security COLA is enough to cover rising healthcare costs? Or are seniors still facing too much financial pressure? Share your thoughts in the comments. If you found this update useful, please like the video, subscribe to the channel, and share it with someone who depends on Medicare or Social Security. And remember, this video is for educational and informational purposes only. For personal Medicare, tax, financial, or healthcare decisions, always check official sources or speak with a qualified professional.